to participate in the processes of life. It is about the time when, instead of being liberated by life, we become its prisoners, awaiting release through death. Yes, she was old. The crowded years around her eyes stood still and cold, and I cannot forget her melancholy face, forever gazing in that little space, like an ancient moon, like the aimless shadow of a wasted afternoon, so pale and frail and waiting. Good years forever gone, good years consumed. What little time that lingers on is doomed. No depth, her pleasures mild and few. No dreams, no luster, nothing new. And every morning summons less of sunshine with it, less who love, and less who care, and less who visit. And still, she's waiting. Fatigue has come to dwell among the crowded years, among the chilly loneliness and fears. And still she hears the fading echoes of her soul resound against a hopeless void. I wait, I know not why. She waits to die, and still she's waiting. I take care of a lot of nursing home patients, and this is an outcome of my impressions taking care of these less fortunate people. The second poem is about a friend of mine who came from the Gulf because he had developed lung cancer, because he had been working with asbestos, and he was a smoker. These are two major risk factors. His name was Bahij Nuhaili. After spending time with Bahij, I came to realize that he was more comfortable facing his death than I was. The contrast between my inconsolable grief and his serene acceptance, my anger at life's injustice and his smiling indifference, inspired this poem. His heroic pathos that even death can be rendered beautiful by change of attitude has amended my perception of mortality. And when we are together, you and I, in the silent room, and it is time to speak, my hesitating phrases cannot find the exit, bounce from cheek to cheek, collapse exhausted in my throat they lie, so utterless and dead. I slowly sit upon your bed, squeeze your hand and stroke your head, and let the clumsy silence cry, hello, my friend, I came to say goodbye, and everything is said. Why do I fear your weary setting eyes upon my pounding chest, tattoo goodbyes? And angry visions pace my mind. I hear their drumming hoofs approaching, and I rise. These tired processes of life must come to rest. And it is time to go, time to recollect the scattered years of memories and woe, time to know that it is all the same, an ancient ceremonial game, a melancholy setting to the west, and you become a name when they will fold your arms upon your chest. And so we part I, wondering, is it wine or blood that beats within your heart? For you lie deep in peaceful sleep, content, resigned, while angry visions pace my mind. So I rebel, I hate, deny, yet in this cold and lonesome place, so fearless and alone you lie, and I remain behind to face the separation and the pain, the fear that I would die again in yet another cold and lonesome place. The last poem is a poem of an aging man writing a song to his lady. They're in their 80s and they are seeing the end of life, the inevitable decay, and he is clinging to love as his savior. Aging is inevitable, and those who do not accept it suffer. While the old cannot compete with the muscle, looks, and vigor of youth, they do have greater resources of emotions and memories to draw upon, and more wisdom earned with years of experience, which provides them with peace and stability. This is the life song of a dying man to his lady. It is a celebration of age, love, and faith, flavored with the beautiful acceptance of reality and fate. Behold, my butterfly, behold, how silver took the place of gold, how cherries red and ripe with years fell off the lips and cheeks like tears. Look how the skin is quick to scold, the hair is sparse, the head is bald, the eyes have lost their glittering, the legs are weak and quivering, with arms that reach to grasp and hold, no longer deft, no longer bold, uncertain, slow and stooped with fear, and growing shorter every year, the senses dull and dim and cold, the mind is young, the rest is old, and death invites, but life delays, and silence dominates the days. The nights are short, the tales are told. Behold, my butterfly, behold. My butterfly, the world is you and I. The verses which you stirred, my soul reply to all the question nature hurls at us, and all the dirty noise and empty fuss, so much a part of our universe, which we cannot enlighten or reverse. I have no fear, my heart and mind are clear. To life I lift my flowing cup and cheer, for I have devoured life with appetite, and humored fate, and ridiculed my plight, and savored love insatiable and blind, with sad and happy glories of the mind. Come, hold my hand, and let the sunset come. Together we will westward walk and hum, for we have loved with passion, touched with lust, as raindrops kiss and quench the thirsty dust, and smudge the steaming cheeks of earth with mud, like so our sweating lips did flood with blood. And though I have been cooked by years and sun, and all my tales are told, and deeds are done, I look at you, and still I flit and fly, for you will always be my butterfly, and I will dance to music of your form, and in you find my quietude and storm. Thank you. That's it.
This is so beautiful.
This is so beautiful.
And so touching. Thank you so much for sharing this with us. Do you hear an echo?
There's echo. There is echo,
Okay.
severe echo.
Right. I don't know what is happening. Okay, so you either can't hear me or you hear me with an echo.
Probably opened another.
Yes. I will need to pause this for a second and then see if I can change devices. I'm really sorry about this. This was so unexpected. Okay, can you hear me now?
Yes.
Is there still an echo?
No.
Okay. Again, so sorry about that. Technology is so unpredictable. So yes, I wanted to comment on this, the touching and the moving quality of all the wonderful, wonderful poetry. And I want to start the discussion by, and this is a question for all of you. Dr. Hirschhorn.
Sorry, Rona, but Dr. Hirschhorn didn't read yet.
Oh, sorry. So I'm so sorry. Okay. Yes. Go ahead, Dr. Hirschhorn.
What would you like? Sorry.
I thought that you already read with Dr. Fouad. I forgot that these were just the translations. So yes, the floor is yours now.
Let me
Please
save
go
it
ahead.
for the end, and we'll go into the discussion then.
No, that's fine. That's absolutely fine. We would love to hear your poetry before hearing you talk about it.
Well, I'll read just one poem that's inspired by Dr. Fouad. And I took it off in a different direction, I think. On the brain, there are two membranes. There's the outer membrane called the dura mater, and then there's the fine inner membrane over the brain called the pia mater. And so I imagine these two are sisters, the mater sisters, dura and pia. One, dura mater. According to the Latin, I'm one tough mother. I must be. I'm the defender, the outer Doberman of the brain. It makes me snarly having to share a bed with my little sister. Let me tell you, Pia's a goody two-shoes, even if Vesalius dubbed her tender mother. Oh, she is limpid. Oh, she is delicate, with all those radiant red and blue vessels, her glistening surface reflecting light, making everyone in the OR go, ah. When the neurosurgeon operates, he barely notices me, just snips on through. But how carefully, how touchingly he fingers Pia on his way to the brain. Never mind. I do my job. I do it well. 2. Pia Mater. Of course I'm special. My sissy's just jealous. Wrinkled old bully. And when she's supposed to be on guard, a teensy-weensy hit to the head. Emergency, emergency, subdural hematoma. I can't help it, I was born pretty. Never mind, I love my sister. Thank you.
Beautiful.
Wonderful. Thank you so much. So, Dr. Hirschhorn, Dr. Fouad, and Dr. Saadeh, why do you write? Tell us a little about your work.
Well, let's start with Bert. he read a letter, so Bert.
Well, I started writing poetry after about 35 years ago, following a hard event in my life. And the first poems I wrote for several years were pretty awful. But having been a scientifically trained person, I was interested in how does this thing work? As Robert Frost said, it's a contraption made of words. And I wanted to know what was in that contraption. How do you do it? And so I just kept studying, took courses, got an MFA, and kept reading. And I still do that. I still take courses. I still study. I still read very widely. And I have to keep the science out of the poem and get deeper into the emotional feeling, and which is not easy.
And you do that so well. And Dr. Fouad, how about you?
Well, it's a bit different story. I think I grew up in a house that full of books and words. From the beginning, from early beginning, I used to read classic Arabic poetry. I like classic Arabic poetry, so I used to show off, in front of my friends, classmates, that I can memorize, hundreds, thousands of Amru al-Qais, al-Mutanabbi, and but suddenly I thought I can write something like them. But of course I failed. It's not at all easy to be, at that level. So I gave up doing such a sort of things. But later I found still I'm full of words. I have something in mind, And that was my first poem when I was like in high school. And I hide all these poems from my family. I thought that it's a shame to show them such naive poems. But then later, someone told me that no, that's fine. They are okay. So and yeah, that was so. I write modern poetry, to say it that way, and never thought about the issue of medicine or writing from my experience doing in medical school later as a physician or a surgeon. But suddenly, years and years after that, I discovered that something there in medicine that's very close to poetry. And that's why my last book, before last one, was about this issue of medicine and poetry. But during the at least four books, nothing there about medicine, nothing there about, but there is something about suffering. And I think that unfortunately, I think maybe this is the common between poets and doctors, that they are very close to suffering. And so that's why I think they write poetry.
Right, and as Dr. Bert said, sometimes a hard time in your life can kind of get you writing. And now you're saying that suffering, so suffering, whether out there in the medical field or making it onto the paper or the keyboard, it's kind of an impetus behind your writing. That's really interesting to see. And Dr. Hanna.
I write when I have an emotion. And if I don't have an emotion, I cannot write. And I don't know why I write in poetry and prose, but the emotion is the impulse in me to write. I did grow up in a home where the mother was a poet. And when our hometown, Amyun, was invaded during the Civil War and we all became refugees, my mother sent me a letter. And in the letter, she says, "We have lost everything. Our dignity, our land, our home, our money. The only thing we have left is poetry." And I subscribe to the idea that for some of us, poetry is proof that life is not enough. We have to have something else in it. And to me, it's poetry. My brain tells me to write, and so I write. Two quotes worth mentioning. One is from Robert Frost. When they asked him, what is poetry? He says, poetry is what gets lost in the translation. And Samuel Taylor Coleridge, the author of The Rime of the Ancient Mariner, he says, poetry is the best words in the best possible order. And I think both are right. And that's why I write. I write because I feel better. I can discharge my emotion that way.
Wow. So it is a form of medicine.
It is. It's a medicine, but not a pill.
Uh-huh. And all of you would agree that, you're right in order to let those emotions out. So you're right because there are emotions. And since the three of you are in a field where, that they actually, we hear a lot that doctors stop feeling things because it hinders their practice. Is that true? Because being poet doctors, I don't really see you there. I see you as very emotional people. I mean, emotionally expressive at least, but so many people say that doctors need to cut the emotional cord because that would hinder their practice. They wouldn't be able to operate on anyone. They wouldn't be able to tell anyone exactly what's their problem. So how would you see this? The question is for the three of you as well. So,
can I start something? I mean, just thinking about this issue of poetry medicine and this issue of emotional, experience and expressing. To be honest, talking myself, I don't feel better after writing. In fact, I feel more tired, more suffering. I don't know. I mean, I like Dr. Hanna when mentioned that, it's sort of healing, sort of medicine, For me, I've never felt like this. I mean, I start from thoughts, idea, sometimes just a few words in mind, and then you write, you think you feel better when you finish. But I don't know. I mean, I go with more painful feeling, more feeling that I'm not very well. So, and that's why many times I put aside the poem after finishing and then back to it, sometimes days, weeks, when I feel better to look into this piece, in a more critical way than just writing emotion or and that's maybe this is the issue of to what extent you can distinguish between, being emotional as a doctor or, disconnect from this emotion. I always be emotional, whether during doing surgery or, writing, or even, in even my daily life. But I think when thinking about poetry, I think poet should write poetry first, regardless of his or her career or profession. Or poetry is an art, and you need to respect the rules of this art. And it's it cannot be justified because you write about suffering or pain or patience, or you write poetry, whether it's on on a patient, or you write poetry on about nature or anything. So poetry is the main issue that poets should respect. And I think that will put a sort of clear border between what you write about and the tool that you use to write something. This issue is, for me, is something that I do not compromise, and I mean, it's not about very strict rules. I mean, you're free, you have to be free when you write, but at the end, you can feel that, I mean, from experience of reading other poets, reading, other issues, not just poetry, novels, literature, history, but always you need to respect the rules of the art that you're doing, and then everything, the subject, the topics, the feeling will come later, and that's why for me it's mixing both is would be nature, but I don't think that I start by writing about medicine, about suffering, and then I look if this is poetry or not. I start in the other direction. I write poetry, and then that's the other issue will come later.
Mm-hmm.
That's my feeling.
Oh, that's very interesting.
In my career in international public health, it would be very easy for me to write about smallpox, cholera, diarrhea. Oh my God. And I find that would get in the way of writing a poem. And I must say, most of my poems fail. But what international public health has done in poetry is to put me into different cultures, different experiences, different languages. And I can use that to create, or to bring out, I should say, deep emotions that I have as a person, not as a doctor. Robert Frost, of course, we quote him, "No surprise for the writer, no surprise for the reader, no tears for the writer, no tears for the reader." And when I come to a poem and I start to cry myself, then I know, like Emily Dickinson said, if it makes my whole body so cold, no fire can warm me, I know that is poetry. And that happens so rarely. It happens rarely, but when it happens, you sigh, my gosh, how did I do that? I go back to some of my older poems that are pretty good, and I say, how did I write that? Where did that come from?
See, this is a question that poets often ask themselves, with poetry and with other forms of writing as well, but especially poetry. So you sometimes feel when you look at a piece that you've written, whether it's recent or old, more so old though, that who wrote this? Could that be me? Does that show that poetry is the fruit of a state of mind? Or is it a state of soul? Is it something longer, but it is something that we tend to notice once we write it, once we pin it down into words? So for, your experiences with poetry and with the different voices that it gives you, when you get the sense that the poem is speaking to you in a language that, or in a voice that doesn't really sound like your voice right now, what does that tell you about it? Does that tell you that it is a state of who you are or who you were at a certain period of time? Again, anyone can answer.
You know,
I've spoken a lot, so I think someone else.
there are so many poems that I read in translation. And as Dr. Hanna says, poetry is what lost in translation. But also poetry is what is found in translation. When you move from one language and rhyme scheme or rhythm to another language that has a completely different format and structure, but yet the images that are in that original poem are the ones that create the emotion. And to do that is a great pleasure when reading translations, or as Fouad and I, when we co-translate, we discover that the words are different, the rhythm is different, the rhyming is different, but the emotional feeling and imagery comes out the same. And that's our human basis of being human.
Uh-huh.
Let me just comment on this, because I think there's a sort of very common popular, say that, poetry cannot be translated. On one side, this could be, yeah, I mean, it's not easy, but I forgot who said that. So I don't want to put any name, but I remember someone said that actually best poems should be able to be translated, And it's not about translating meaning or rhymes or, I don't know, even images. Sometimes you find something in the second language, in the new language, that can express the same. And I think that was my great experience with Bert when we worked on this translation. We didn't meant to translate word by word, not even sentence by sentence, not even paragraph by paragraph. What we did is we enjoyed rebuilding the poem from scratch. We used maybe some materials from here and some stones, some tiny issues from here and then we rebuild the entire poem. And the product sometimes looks like the original one, other times that's different, but we both enjoyed building from this raw material, dismantle the original one, then rebuild with this components to have. And I think that's the issue of what poetry is. Maybe poetry is not these images or words or the music. Definitely it's mixed, but there's something really, strange. And that's why I feel poetry is not an art related to words. It's something related to music or maybe fine art. It's not about the meaning, though, sometimes the meaning is very powerful and strong. Something weird behind the meaning that can find when listening to Bach or listening to, sort of great musician or something there in this fine art more than in the word itself. So it's a strange art. It's really strange art.
It's very interesting when you say that it's not about understanding, it's not about words, it's about the feeling of the poem. So oftentimes, many good poetry, just like some great abstract art, you can't really find a meaning, you can't fix the meaning to it. So the key here lies in the feelings that it causes in the listener or in the reader. And I think this is why, for example, the word for poet in Arabic is sha'ir, or the person who feels. So this is about the feeling more than the words. Now, of course, words are important, as you said. We need them in order to compose a poem, just like we need notes to compose music and paint to compose art. But since words are the key, again, how do you choose your words, or do you choose them? When you are writing about what you see and feel, during medical practice. So what you see in the ER or in the OR or what you see in the clinic, and then when you want to write it out into a poem, whether it's a poignant moment, someone is giving birth, someone is dying, someone has just been cured from some terrible illness. I mean, these are very emotional moments. But how do you write about them? How do you choose your words, or do the words choose you? So do they come to you, or do you look for accuracy when you are describing such moments? Dr. Hanna, you use a lot of rhyme in your poetry as well. Some brilliant rhymes. How do these come along? And they come along perfectly. They're just so part and parcel of the moment that you are describing.
I write by feeling. If a word doesn't feel good, I don't use it. If a sentence doesn't feel right, I don't use it. The beat is in my brain. It just hops. And the words have to satisfy the feeling and the beat. And when you write it, you have a strong feeling that it's the right thing. And if you don't, it won't be good. So I'm a writer by feeling, and only by feeling. I really don't use any other tool. And as far as, hiding my feelings from my patients, I cannot. I tear up, I hug them, I call them at home, I write them notes. I totally violate the ordinance of detach your feelings from your patients. I cannot do that, and I have never been able to.
Rula, can I ask Dr. Hanna a question? I'd like to have it like a sort of friendly discussion more than, because I was curious when listening to Dr. Hanna and now his answer about choosing the words, because I know how difficult this issue when you have in mind many words sometimes to express your feeling or your emotion, Dr. Hanna. But I saw, I listened, and so that in your poem that there's a specific word that should have the same rhyme sometimes, So what if this word that came to mind wasn't the same rhyme? So did you change the rhyme to different lines, or did you try to find another word that fit with the exact rhyme that in the previous line? So technically, how that happened? I'm really curious on this issue.
Just like you said it. You said the words find themselves, and if I cannot put them in a rhyme, I'll put them in the middle of the line. If I cannot find the rhyme, I can change the rhyme. But rhyming is not primary, it's secondary. The primary is the word impact, meaning sometimes just the word order gives you an impact that each word does not carry. And we've all have experienced that, where you stack them together and they have wonderful meaning, but alone they're very ordinary words. And I think everybody who's written poetry knows, find the best possible words in the best possible order. And rhyming is fine, but forced rhyming makes a poem worse. So you don't want to force a rhyme. That makes it very, very bad. So what you said was correct.
That's the difference between great poet and not very good poet. So forcing the rhyme sometimes that will definitely affect this feeling of the poem. Thank you.
We poets have tools available to us. So there's a rhyming dictionary. There's a thesaurus, which are many, many synonyms and related words. And we go to those, and sometimes what happens is you find a synonym or a rhyme that changes your whole poem. You are surprised that, oh, I didn't mean that, but yes, this is more interesting. So we're not doing it, it's not just jumping out of our foreheads like Athena out of Zeus's forehead, you know. We actually have tools, and another set of tools are reading poems by other poets of all kinds. Abstract poems, emotional poems, poems that are about a story, narrative poems. And we absorb all those words and all those poems, and they come in and feed our own poetry without our knowing it.
Yeah, I think I use this technique, you know, to say that. I mean, reading is something that, you know, I mean, not just in poetry. I read, you know, actually I like read science more than poetry. Physics. I see physics is very poetic, you know, science. You know, think about this parallel cosmos, or think about this Big Bang, or this, you know, it's not real issue, though it's very scientific and real one. So thinking about this in between abstract images, and you cannot think about black hole as sort of, you know, something that you can see it in your eyes. You know, black hole is an image, and you need your you know, sort of creative you know, sort of thinking to get an idea about what is black hole, what is parallel, you know, cosmos. What, you know, and I think these, I mean, reading are something that give you huge dictionary, you know, from very classical poems to, you know, very modern. So I think words will be in your, though it's not jumping bird, you know, but something that naturally sometimes you feel. But definitely when you come back again to the poem, and then you feel that you need to be more sensitive and change this one by that one, you know, reorder the words, you know, and that could, there's another level to say in writing skills, you know, after the first, say, emotional writing.
Yes, that's very interesting, what you just said now, because that is true. Physics, I mean, science in general, and physics especially, is very poetic. And it has been often said so, you know, by so many famous physicists and scientists. We know James Maxwell used to write poetry, and Richard Dawkins said, poetry is, this science is the poetry of reality. And funnily enough, I can relate to that as well. So many people also say that I do tend to use scientific, although I'm not a scientist, but I do tend to use scientific words in some of my poems as well. For example, last year when the nitrite bomb in Beirut, and the huge Beirut blast, a poem came out called Entropy, because the whole idea of entropy, the whole idea of the chaos and all that, I mean, I found in it so much description, so much accuracy to what was happening, to all the suffering and the never-ending hell that was happening. And Dr. Burt also mentioning the thesaurus, and mentioning how sometimes you could find a word that changes the whole meaning of your poem as well. That's brilliant. And you know, nowadays when people talk about arts-based research, not just the painting and the music, but even the words. So as we are composing poetry, which is different than, for example, the research that we need to make before writing a novel or before writing a short story, but when composing a poem, we do tend to learn new words by looking for alternatives. So sometimes we see that there's a lot of repetition, and we want to kind of diversify and be a bit more eclectic in the way that we express things. And we do come across a word that changes the whole meaning, or that gives us new ideas, or that probably teaches us about something. Yes.
There's a message on the chat from Yasser Al-Hadadithi. Science is the poetry of reality. And going back to physics, if an equation is not beautiful, it must be wrong. And in poetry, it is said that poems should delight and surprise.
Mm-hmm.
Not delight as in like happiness, but delight as in arousing a feeling.
Mm-hmm.
But the surprise part is the interesting word. And so when an equation in physics comes out that seems to describe something in reality, it has to be beautiful. Otherwise, it can't be right.
And does poetry show us the beauty of everything, even the sad feelings, even the negative feelings that we feel?
No, it can show ugliness.
Mm.
I think a lot of my poetry is pretty grim, actually.
Okay.
In fact, I like grim.
Yeah. So see, there's an aesthetic side to grimness.
Yeah, sure, definitely. I mean, of course, you know, there are some very lucky poets that can write about happiness, about fun, and they have also very great poems. But unfortunately, I mean, I see this is common among the three of us, that, you know, the poems uh, um, are about also pain, you know, and about suffering and about, you know, unfortunately death, you know, so very green, you know, and dark, which is sometimes, you know, it's not usual. We shouldn't being in this melancholic mood, you know. That's why I like the last poem by Bird about this Mata and her sister. So it's something different about this, you know, very dark mood that unfortunately we all stuck in it.
So we tend to write when in a dark mood more than a happy mood, let's say. How about when we read poetry? When we read poetry, do we tend to read poetry or to reach out to poetry when we are also a little bit down? So let's say after a hard day.
No, it's not a therapy. It's a craft that one practices at, and practice includes reading. And so I read poetry every day, whether it's on the screen or it's in a book I've just bought. And I feel like I absorb a lot of different kinds of poems. Some I like, and some I don't like, but even the ones I don't like are teaching me something. So it's not like a tranquilizer. It's part of the craft.
How about when people don't read it for feeling better? Like, let's say you have a very dark feeling, let's say you're mourning, and you want to read a poem that was written by someone who is in the same state. So maybe people reach out to poetry so that they could, you know, they could find a better channel where their feelings are more articulated.
You need a disaster to create the popularity of poetry. More poetry after 9/11. More poetry in Lebanon, truthfully, after the explosion. So people turn to poetry at moments of distress, disaster, but these are the readers.
Right.
And all good poets need good audiences.
Thank you. Any other comments, Dr. Hanna, Dr. Fouad, about the idea of when we turn to poetry?
In the Arabic culture in Lebanon, people quote freely during life situations. You know, something happens, all of a sudden, mutanabbi verse comes out of somebody's lips who may not be a highly educated man, but he knows how to quote. And everybody who has lived in Lebanon has heard parents and friends and families quote things very appropriately at the right moment, and they do have an impact. It's wonderful that that people remember them at the times when they need them.
What about the different voices of poetry? Do you feel that you retain your doctor's voice in the poems, or do you tend to diverge sometimes as well? So is it always the doctor in you who is writing, or do you kind of explore the many other selves that are in there?
Yes, for me, I've never thought about it. I mean, actually, I didn't, again, as mentioned at the beginning, I didn't start writing, thinking about, from this, to say it in this narrow, say, a window of, I don't know, medicine or diseases or public health. I mean, again, this is poetry, and so different voices should be there. And even sometimes, although we're talking about styles, but sometimes even you need to think about that. You need to change your style, and that sometimes happen naturally, by experience, by time. So you start something and ended up like in a different style of writing, and and I feel that having diversity in writing, in topics, in styles, even in the emotion, I think this is something important, at least for me. And I don't stuck with one mood, one style, and one voice.
Yeah.
Fouad, when you wrote the poems, the wolf in the hospital corridor, and the other poem,
The wolf in the corridor.
The wolf in the hospital corridor, and then the other one, the reports from a far hospital. You were writing these in the time of Syria, and what was going on in Syria when you were still living there.
Yeah.
So that prompted it, but it wasn't like directly saying something about Syria, about the regime.
Bert, I think these are, this is a good example about two different timing. The one of report from Far Hospital, surprisingly to say that I wrote it when I was a resident for doing surgery. I was in mid-20s in Aleppo, and in a hospital that unfortunately bombed later after 30 years. But I was in that hospital during the 80s in Syria, in Aleppo, and that time was very difficult situation also, like what happened after 2011. So there's sort of uprising, and also the regime at that time, attacked, people, bombing, several entities there. So, but I didn't start this, or didn't write it from this, general experience in Syria. Actually, I wrote it because my mom was dying because of breast cancer then. So I was in this mode of death and dying, and being a new surgeon, doing my first steps in surgery that time, seeing all these issues of, people are waiting in front of the operating room, waiting for good news, and many times bad news. So all this feeling, and then I was waiting like them, not just like waiting for my mom doing this cancer surgery, and being suffered later and died. And so then came this issue between your own personal issue, and then what happened in the country, without writing directly about it.
Yeah.
So the other one, the wolf in corridor, happened years later, 2 decades later, actually. It's also that feeling of, but I was, then, sort of advanced surgeon, have my student there, but also the country happened to be in also very difficult situation. But again, it wasn't about the country. It was about my experience, also my personal experience later on another one that dying. So yeah, it is, you don't go with having in mind that, well, I now want to write something about Syria or Beirut, but it happened suddenly because of you feel on very specific, special personal issue.
Yeah.
Mhm.
Emily Dickinson said, "Tell all the truth, but tell it slant. Tell it slant."
So I asked you about the role that your professional vocation, let's say, plays in your poetry. What role now does poetry play in your professional life? In other words, do you take your poetry to your patients, whether literally or figuratively? So do you read poetry to your patients? Do you share your work with them? Or does poetry teach you or train you in a way that teaches you things about your medical practice or the way you deal with patients? Does that happen? So do you bring your poetry into your medical practice?
I do.
No.
Uh-huh.
I do all
Dr.
the time. I read poetry to patients. I quote poetry, especially in situations which require a quote. And the patients are, like Dr. Hirschhorn said, surprised that somebody has said something which is so appropriate for them to hear. And but I do share, liberally share my poems with my patients.
I like how you said, especially in situations that require it. So this is amazing. You feel that there is a moment between you and the patient that requires some poetic translation of the situation that they are in.
Yes.
You feel that it helps them.
You know, your brain has so many quotes. Hundreds. And most situations that present a difficulty, you can pull a quote out of your brain and use it, and the people feel better when somebody else has done the thinking and the feeling and phrased it in a way that's surprisingly simple.
That's wonderful. Mm-hmm.
Well, I have different experience, if you allow me, Rula. And I didn't read poetry to any of my patients when I used to practice. Actually, I stopped practicing since I moved to Lebanon. So I didn't. I mean, this is a different issue. But I think what I brought from poetry into the practice itself is that sort of feeling patient. So feeling this, you know what, if the dream of any poet is to go to understand the inside of a human being, surgeon can see this inside literally. You know, you can see, you can understand literally.
Yes.
You know, you go in literally. It's not, you know, a metaphor. It's literally you go in, you see the spleen, you see the, you know, the stomach. You can feel the warmth of blood. You know, and also you can feel this sort of pain and suffering, and not just the patient, but his organs, his or her organs. You know, you can feel if they are tired, if they are, you know, suffered, if are so. So what I wrote, if I did that, I don't know. I mean, I didn't think about it. I think understanding deeply what they feel, you know, and understanding not just from the medical perspective, you know, I understand even the link between their social life, their, you know, with their, you know, medical issue, their, you know, mental health issue with their physical issue. So I you know, it came actually without bringing the tools of, I don't know, doctors to do this long history, you know, but it also it comes naturally, talking to them and then you open doors and doors inside them, and you go in and you wander inside and you see, and that sort of I don't know, issue is what I think I brought from poetry more than from medicine.
But this is so powerful. I mean, the way you juxtapose what you see literally with what you see figuratively, that's just amazing. And this kind of explains the powerful imagery that we heard in the poems that you read in the first part. So yeah, that is something.
Yeah, I have friend inside.
Yes.
I have people inside. They tell me what to do, what to write.
Yes. That's incredible. Yeah, and Dr. Hirschhorn, how about your experience with poetry in with the patients?
Well, I'd stopped practicing many years ago. I was an internist, and that was before I started writing poetry. And I went into international public health. And what simply has brought to me is the opportunity to experience different places, different people, different cultures, different food. I'll read a little bit of those kinds of poems afterwards. So I'm not trying to cure a country or make a country feel better about itself or bring solace to a country or to people. It really is a selfish. It's really a selfish attitude on many poets' parts. This is for me. There was a very famous exchange between Seamus Heaney, the Nobel Prize laureate, the Irish poet, and he's riding in a train, and the IRA man comes up to him and says, "When the fuck will you write about us?" And Seamus Heaney says, "I write for myself." And Mahmoud Darwish said almost the exact same thing. They said, when are you writing more about Palestine? He says, "I'm not a politician. I write for myself." And I think that's the kind of attitude I've taken to poetry.
Mm-hmm. Wow. And that's what makes it honest and spontaneous and genuine in many ways. So thank you so much for this wonderful discussion. And I've asked a lot of questions, and I'm going to give the floor now to some audience members who I'm sure will have so many questions to ask. I see tons and tons of questions and comments in the chat box. So I am going to set this onto gallery view and invite the audience to either use the raise hand button or switch their cameras on and wave if they have any questions, and then you may use the mic to ask your question or to give your comments. So we will have 15 minutes of Q&A, and if anyone would like to go first.
And also, it will be good if they comment more than just asking.
Yes,
I mean,
of course,
it's good to have the experience of people. I mean, more than just.
We would like to hear what they think. So, okay. I guess that means we need to at least start by going back to the chat box. I can't see any hands here so far.
There's a few hands I see.
Yes, now I can, yes. Okay, we see Ahmed Al-Quraishi. Ahmed, yes, feel free to use your mic, please.
First of all, thank you all professors for telling us about your experience and the poetry. And I have a question for Mr. Fouad. Mr. Fouad, you said that I have a question for you. When you write a poet, like a poem, what is your main genre? I'm sorry if I'm using the Arabic, like you like to write al-wafa, al-ghazal, al-fakhr. What do you prefer writing?
Yeah. Thank you, Ahmed. Well, I don't write, with something about the topic in mind. So I don't write, for example, saying that, well, I will write a love poem now, or I will write a sort of, a satire poem, or, or fakhr, or I don't know. I mean, I don't start by doing this. I feel something reflecting on something also. That could be explosion in Beirut, or could be, emotion toward a woman, So, and that feeling that I follow up in writing. And sometimes, strangely, to tell you the truth, I mean, sometimes that you have in mind one sentence, only one sentence, or few words, and then you feel that you feel something a bit unusual, that you want to build on this sentence or few words, and then it leads you to different directions, and you need to follow your feeling, and ended up you have something that you might not expect from the beginning. So it's not in this topic, the traditional classical, which I really like, Arabic poets, that they have this subject to say, or this sort of I don't know how to call it, schools of in writing, but it's from exactly following my feeling, my emotion.
Okay,
Thank
you,
you.
Prof. Thank you.
Thank you.
Thank you. We also have a question or comment from Ms. Najla.
Yes, thank you for taking my questions. Thank you, Dr. Fouad and Dr. Saadeh, whom I know personally, and it's amazing to have you both on the same panel. So I want to thank you for an inspiring and enlightening morning. You made me remember that doctors are human beings and function as human beings, whereas now in the States, I don't often feel it. It has become a business. Medicine has become a business, and I have discouraged my kids from going into medicine because of that. But you remind me of what a noble profession it is. And I wanted to ask, and this is the three of you, not just the two of you, but the two Arabic ones, Dr. Hanna A and Dr. Fouad. How much of what you feel or write or whatever is due to your Arabic background, do you feel?
Yeah, if I can answer first quickly, I write in Arabic. I think in Arabic, I write in Arabic, and I came from this cultural background, and I didn't try to write in English. So what happened later is that some of these poems translated into French at the beginning, then, into English, and then when I met Bert 10 years ago, you went to this adventure about reconstructing these poems in English, but I think only in Arabic. So everything came from this background, at least for me.
Dr. Saadeh?
But in his poem Ulysses, Alfred Lord Tennyson says, "I am a part of all that I have met. Yet all experience is an arch wherethrough gleams that untraveled world, whose margin fades forever and forever as I move." I am a part of all that I have met. I'm a part of Arabic poetry and English poetry. But lately I've written mainly in English, but I have written quite a bit in Arabic too. And sometimes Arabic lends itself so much better to an expression than English. The trouble is having an audience, like Dr. Hirschhorn said. If you don't have an audience, it is very hard to test your poetry and very hard to read it and share it. So since I don't have an Arabic audience here, I tend to write more in English.
So the question is really not about the language itself, whether it's Arabic or English. It's your upbringing and using your emotions and your feeling in your everyday life, as opposed to setting it aside and looking at the patient strictly as a disease.
No, I don't. The father of medicine, William Osler, says the good doctor treats the diseases the patient has. The great doctor treats the patient who has the diseases. And I look at patients as comrades in the struggle for life, and everything I see in medicine carries over into my poetry unconsciously or consciously. I don't specifically sit down to use it, but I'm a part of all that I have met. And I have met a lot of Arabic, a lot of English, a lot of patients, and they all become a part of me.
Thank you. And thank you, Najla, for your question. Now I see Lean. Lean has a question or comment.
Hello, first of all, I want to say thank you all. I learned so much today. And I have a question for Mr. Dr. Fouad specifically. Dr. Fouad, as you were speaking, you were saying that once you're done with the surgery, you expect to feel better, but you said that instead you feel more painful. May I please know why you feel more stressed or pressured once you're done with the surgery rather than relaxed?
Well, wallahi, I don't know, Lean, exactly why I feel difficult, tired after writing. Not, to be honest, I mean, never thought about the why, but maybe because every, when you write, when you do surgery, you finish the surgery, whether it's, hopefully, we all hope that we do it well, we do it right, we do it in the purpose of healing and, reducing suffering. But it ends, when you finish your work on the, operation theater. But in writing, I think it's a whole life process. You don't finish when you finish your poem. You feel something still there, and you need to express. But for some unclear reason, you stop. You stop because you cannot keep, with this energy of writing. It actually, you consume a lot, when you write. So, which is different, to be honest, from as I've heard from, fine artists, that, they usually they are happy when they put the paint, on this, on canvas. So they feel happy because they see the color immediately. We don't see colors. We see words that are sometimes meaningless, and you still feel that you want to express more about this. So I always feel unfinished, when I end up the poem, and that's maybe behind the feeling that why I'm not happy.
I understand. Thank you so much. And I do
Thank
have
you.
a comment.
Thank you for
Actually,
question.
I have a comment to say, because I listened to both poems, the English one and the Arabic ones. So I just want to say that with the Arabic ones, I think it was more emotionally appealing to me. أنا بعشق الشعر العربي صراحة. فحسيت ما بعرف, I felt more drawn to the Arabic poems more than the English. I feel like in Arabic, the Arabic words, in the Arabic language, there are more Arabic words, there are more words that can, how can I explain, describe emotions more than English. I really don't know why, but I feel like when there is a poem written in Arabic, it is much more, you feel more drawn to the poem, and you really feel more, like you relate more. So I just want to say that I really love both English and Arabic, but the Arabic ones, I don't know why, I felt more emotionally drawn to.
Yeah, thank you. Thank you.
Thank you. And thank you, Ms. Rola, for telling us about this, because I really did enjoy it very much.
Thank you very much. And next, Eleanor. Eleanor?
Yes, hi. I just wanted to say that this has been a very inspiring meeting, and I had a question. So some of you mentioned that you started writing poetry while practicing. I just wanted to know, how has poetry helped you through your practice? Medicine is not an easy thing to study, and it is a very dense field to go into. So how do you feel poetry has helped you through that? Has it made it any easier, or just in general, how has it helped you?
So this question is for everyone, or is it for anyone specific?
For all three, for Dr. Norbert, Fouad, and Hanna.
Okay.
I think Dr. Hanna, will be better than us. We stop practicing. Maybe that can bring more practical, to say, and tangible feeling. So, I mean,
Okay.
we defer to Dr. Hanna.
To me, medicine and poetry are intermingled. It's very difficult to separate them. And the journey of the doctor, which is unique and very, very sometimes painful and difficult, but poetry usually helps me see things better, maybe understand things better, because when you start writing, you cannot anymore render impromptu opinions. You really have to think very carefully about what you're saying, and that helps your emotions. I write sonnets to my patients who have died, sonnets to my patients who have survived, sonnets to mothers who have lost kids. I have a lot of poetry written for patients, and I give them to patients. So to me, it's a discipline that is part of my ethos and pathos, and I don't know how to separate them. It's like Robert Frost, my vocation and avocation are like two eyes who are one in sight. That's, to me, they're just one, like two eyes.
That was very beautifully said.
Very
Thank you so
generous
much.
of you to do that, to give those gifts to patients. Yeah, I admire you for that.
Really is beautiful. It really does show the humane side of medicine. And for me, let's say as a patient, sometimes this is the part that I look for. I mean, the skills are obviously very important, but the skills, and at the same time, the type of not just closeness, but the level of humanity that you find in a doctor is very, very important. So it puts your mind at ease, even when you should be worried. It kind of shows you that the doctor understands how you're feeling. So a doctor that gives poetry as gifts, I mean, that's just amazing. That's really great. Okay, so thank you. And we have time for just one more question before our three doctors will share with us some of their poems again. So Joseph.
Yes, hello. I would like to ask my question to the three doctors, and specifically Dr. Norbert. What advice could you give to young poets that are not sure what to write about, or don't have a specific genre to write about, but have the passion and are willing to write something, whether in Arabic, English, or French? They're interested in writing, but they don't know where to start. What advice could you give to these people?
Rilke wrote a wonderful monograph called Letters to a Young Poet. I think it's, there was one young poet who said, I'm so upset because all the good poetry has already been taken. And I think the only thing that one can do is to continue to read other poets. They are your best teachers. Yes, I've taken courses, there is a craft to be learned, how to put together poems in form and different kinds of forms. But reading other poets is probably the best way to go. And then you let yourself go into a kind of a state where whatever is in your mind at the moment, whether it's love or whether it's tragedy, sometimes the words will find you. I think that maybe that's what I should say. You don't find the words find you. Mm-hmm. And it just comes with years of working at it. There are very few poets like John Keats who in 2 or 3 years could write all the great ones, some of the greatest poems in English. Of course, he had tuberculosis, and his brother died of tuberculosis, and those were all in the back of his mind. But his poems, he was an amazing craftsman at a very young age. Most of us don't have that gift. We just have to slog through by study.
Okay, thank you, Dr. Norbert.
I hope that answers the question.
Thank you. Thank you, Dr. Hirschhorn and Dr. Fouad and Dr. Saadeh. So now we would like to hear more of your wonderful poems. We will start with you first, Dr. Hirschhorn, so that you can read some of the poems that you might have started to read during the first part.
Let me read 2 poems. These are love poems to Lebanon, where I spent a dozen years. My wife was working at the American University of Beirut, and I spent much time there. In the hot summer, we would go up to a mountain village called Dirishwer, and you could sit in the balcony and just watch things happen all through the day, from morning to evening. So this first poem is From Our Balcony, Dirishwer, Lebanon. A diesel-driven tiller sputters across a patch of farm. Roosters cry up the morning. Someone downstairs chopping parsley for tabbouleh. Dump trucks grinding gears. The pushcart seller calls out, potatoes, tomatoes, aubergine, beans. Our neighbor's cigarette cough, hawk, spit. A wedding entourage winds up from the valley, staccato honking. Bees in the lavender, tree peepers glissando. Shotgun shooters drop birds out of the sky. A single dog howls a cappella. Last call to prayer from a far-off mosque. Cicadas grow still. Susurration of wind. At night, an owl hoos softly. A rabbit squeals. And then, Beirut, mon amour. Because the man in his BMW stops at the crosswalk and waves, welcome, go ahead, I won't hit you. Because young people call me uncle, Ya'am. Because of civil war, warlords, and bullet-pocked buildings still here. Because of 200,000 dead, 20,000 missing. Because Abu Ali, over 85, harvests trash in his ancient truck. Where are my children? Meze, Mune, Tabbouleh, Mujadra, Mankushe, Kibe, and Arak. Islamidaic, bless your hands. Because the electric companies' neon signs are out. Because friends worry if I look sad, although they have more reason. Because the muezzin's first call echoes through my dream. Come to prayer. Come to salvation. Because soldiers on guard fiddle with smartphones. Because fierce-looking bearded men cuddle infants to their chests. Loving Beirut is like swimming in honey. Each time I leave, she won't leave me. Thank you.
These are so beautiful, Dr. Hirschhorn. Would you like to share some more with us? I mean, we would definitely want to hear more. So if you have any that...
Can I ask Bert to read the one of Abu Muhammad, Bert?
Which one?
Abu Muhammad, the shoe cleaner.
Oh, I don't have that at hand.
Oh, sorry for that.
I know,
mean,
but
it's amazing one.
I'd have to look for that one.
Yeah.
Okay. Any other one? I know that you had some prepared for the early part, and you didn't get the chance to read them all.
I will read one also about Lebanon, following the Civil War. And this is called The Disappeared, and it's dedicated to my partner, Fouad. The Disappeared. What makes us human is soil, landfill of bones, shredded t-shirts, jeans, mass graves paved over for parking. What makes us human are portraits, graduation, weddings, mounted in house shrines and on flyers. Have you seen names inscribed around memorial pools and incised on granite? Names waiting for that slice of DNA, any piece of flesh, to be buried along with grief. What makes us human is soil, to stare into a hole in the ground, fill with the deceased, throw earth down, place a stone, bread, salt.
Wow. Absolutely.
Very powerful, Bert.
Very.
Very powerful.
Thank you so much for sharing them. And Dr. Burt, are these all from the latest collection? From the same one?
No, this is yes, this was The Disappeared was from a forward for the latest collection with Fouad, Dr. Fouad. The other poems are in my other books. Bert Z Poet, BERT-Z POET at bertzpoet.com. That's my website. So you can see the other poems there.
Thank you so much. I'll be sharing it now in the chat box. bertzpoet.com.
BertZPoet.
Mm-hmm. Okay.
Right.
Great. Thank you so much, Dr. Hirschhorn. Next, Dr. Fouad.
Well, I read a lot, but as Bert read about Lebanon, Beirut, I also want to have a small one dedicated to my home city, Aleppo.
Mm-hmm.
And it is translated into Once Upon a Time in Aleppo and published in Arabic in the same title. And I choose this one, all the book about Aleppo, I choose this one because it was the last poem I wrote before I left Aleppo. And that was on the night sitting in the dark. So I will read it in Arabic. And I don't think I read it in English now, so sorry for that. So I will keep this, we'll have this only this sound of maybe for our dear audience in English. So على شرفة البيت أجلس حلب أمامي سوداء وموحشة قرقعة صحون في العتمة تعني أن ثمة حياة تحدث على طاولة قريبة لا نأمة سوى رشقات رصاص متقطعة من مكان ما وقذيفة واحدة يسبقها صفير غريب ثمة من يترك الآن هذا الكوكب بحلق جاف حلب أمامي سوداء وساكنة الظلال العملاقة هذه ربما لأشجار ربما لغيلان قادمة من حكايات بعيدة في الطفولة ربما هو بخار أسود ينفثنه الآن نسوة ينتظرن أولادا صاروا أرقاما في نشرة الأخبار حلب لا نقرة عود لا قد يميس لا كأس في العندليب لا ندامة ولا غناء واحدا فواحدا يستيقظون وحوش العتمة. Thank you.
Thank you so much. That was very, very powerful and very moving. You don't want to read another poem?
No, it's fine. Thank you.
Right. Thank you, Dr. Fouad and Dr. Hanna.
Would you like another poem? Or
Anything you like.
well, I'll since I have a short story.
Okay.
Is that okay?
Yes, of course.
Or should I go with more poetry?
You can do the short story if this is what you prefer. That's absolutely fine.
Well, the short story is short. It's not a difficult read.
Okay.
It's about life of aging patient of mine who aged, and how do I put this? Okay, I'm trying to move the.
Okay, yeah, take your
Oh,
time.
here we go. Here we go. We're fine now. Yeah, I just have to move. The story is called Silhouette. Whispers are shy kisses, I thought, as I watched the octogenarian couple snail on the dance floor, few steps behind the music, balancing one another with amorous caution and clinging with frail arms that defied gravity. Their cheeks glowed with hushed joy, their lips gleamed with sunset smiles, and their eyes beamed like nightlights from behind their swooning eyelids. Remote from the tenebrous ambience of the restaurant's dance floor, my wife and I sat in an alcove while I watched geriatric love cling to life with defiant disregard of years and circumstance. And when the music leaped from tango to rock and youth quaked on the floor, jarring gyrations, their movement maintained. We're getting echoes. So the movement maintained its measured pace, echoing the siren keys. Echoes, getting echoes.
Dr. Hirschhorn, I think maybe it's, yeah, because your window is blinking. Maybe you need to mute. Yeah, thank you. Thank you. Let's see now if it's working.
And when the music leaped from tango to rock and youth quaked the floor with jarring gyrations, their movement maintained its measured grace, echoing the siren tunes of their inner harmony, unaware of the surrounding bedlam. What are you looking at? Snapped my wife, a bit perturbed at my taciturn inattention. I'm watching that elderly couple dance. You must find them more interesting than me, she reproached half seriously. Observe their buoyant reverie, their sublime emotional dimension, their defiant passion, and their cherished solitude, as if they're here, but not here, and with us, but not with us. You and I were like that when we first met and fell in love, she lamented. We are still like that, darling, but only when alone. Are you too embarrassed to show intimacy in public places? She challenged. A public display of emotion after so many years of marriage would seem unbecoming. Are you suggesting that we wait till our 80s to behave like them? She smiled. We have what they have, darling, but ours is no longer new, which is why it must remain private. They are in the spring of love, and we in its autumn. Their orchards are full of blossoms, and ours of ripe fruit. Do you know them? The man was my patient. How about the woman? I know of her, but this is the first time I see her. Are you going to tell me their story? It would be a HIPAA violation. Tell it without names or records, doctor, she snapped. I can only see their silhouettes from here and would not recognize them if I were to see them again. The man, a retired army captain turned realtor, let's call him Adam, was married to a heavy smoking diabetic lady, let's call her Eve, who ignored medical advice, did not take her insulin as prescribed, and continued to smoke with nonchalant disregard of consequences. Adam complained about her every time he visited my office, but I was never able to influence Eve to take better care of her health. As they grew older, Adam became more depressed, while Eve lost more weight and her lungs failed. Her visits to my office became more frequent and more cumbersome because of frailty, failure to thrive, and emphysema. But in spite of failing health, 2 heart attacks, 1 stroke, several pneumonias, a foot amputation, and oxygen dependence, she managed to survive and laugh in my face each time I urge her to stop smoking. I turn my oxygen off when I light up, was her favorite comeback. Adam became a full-time caregiver and had to delegate his business responsibilities to their 2 daughters because he could no longer leave Eve alone. He and I commiserated about Eve's decline, and I had to augment his antidepressant to keep him functional. 2 months before I retired, he called me at 3 in the morning sobbing. Eve has just died, he cried. She woke me up choking, clasped her chest, rolled her eyes, and turned blue. I did not try to resuscitate her because she did not wish to be resuscitated. Are you alone with her? Yes, but our daughters are on their way, and so is the police. At the funeral, Adam was inconsolable. Instead of relief, he felt guilt for not having loved Eve enough during her final years. She was too much, doctor, and drained my love and my patience. We were high school sweethearts. Oh, you should have seen her when she was young and beautiful. I was the most envied groom of my generation. After the funeral, I did not see Adam for several months. But when he came for his annual exam, he told me he was back to work and that his daughters were staying on because he did not feel as capable and energetic at 85 as he did at 75. He also mentioned that he had a love interest, a widow who had been their family friend since high school days. We have been dating for a few weeks now, and my daughters are appalled, but I don't care because I'm happiest when I'm with her, and I feel profoundly alone without her. Do your daughters spend much time with you? We are only together at the business. Since I've started dating Helen, they seldom come home anymore. Are you planning to marry her? I would love to, but she's against it. She believes that if we could keep our independence and not share children, we would be able to keep our relationship pure and free of interference. Children will harm our rare and precious love, whether they approve or not, she insists. Like me, she had a hard marriage, and her children do not approve of us. Reviewing Adam's chart after his heart-to-heart conversation, I noticed that he was not taking his mental health medications. Why did you stop your antidepressants? I asked, surprised. Because I no longer need them. When did you realize that? After my first date with Helen? I flew home like a bird, free to sing, free to live, and free to love. Love must revive youth because I feel young again. Are you happy for us, doctor? Or do you think that we're just old and silly? On the contrary, I am awed and overjoyed. Don't let anyone take away the happiness you two have resurrected in each other. Life is short. Happiness is even shorter, and resurrection is rare. You have been blessed with a second life. Live it to the fullest with God's blessings, and remember this quatrain from Rupert Brooke. Now that we've done our best and worst and parted, I would fill my mind with thoughts that will not trend. O heart, I do not dare go empty-hearted. I'll think of love in books, love without end. On my way home, having told my wife the story of Adam and Eve and of Adam and Helen, she said nothing for a long while and then abruptly asked, "If I die before you do, could you fall in love again?" "I would hope so," I replied without hesitation. "Not me. I'd rather live alone and die alone." "Please do not say that, darling. Do not make promises you should not keep. Romance, which is love laced with desire, the desire to unite bodies, souls, days, nights, and lives, is one of the few meaningful passions that can rejuvenate old age. Saying no to that kind of love is a betrayal of life, not a betrayal of your deceased husband. Romance will help us die while feeling new instead of old. All the other loves of family and friends cannot do that for us. Dying while feeling aged prevents us from celebrating the ends of our lives, whereas dying when feeling youthful helps us die with joy in our hearts, that sublime joy of having found romance again. This has been too much for one evening, she sighed as she wiped off a tear. I don't want to talk about old age and death anymore. Let's just hold hands and be quiet until we get home. At home, in bed, with the lights off and still holding hands, my wife whispered, "What are you thinking?" "I'm thinking of what Gibran said about love in the Prophet. I've never really understood that one line until tonight." "What line? What did he say?" "He said, when you love, you should not say, 'God is in my heart,' but rather, 'I am in the heart of God.'" "And what did he mean by that?" "He meant that to know God, we must love, because love is what delivers us unto God."
So beautiful.
Thank you.
Thank you. Thank
Thank you.
you so much. I want to thank you all again, Dr. Hirschhorn, Dr. Fouad, and Dr. Saadeh. I would want to thank the wonderful audience this evening, and thank you so much for using the chat box so well. I'm sure there are tons of beautiful comments and so many nice things to say to all the wonderful speakers with us tonight. Again, thank you so much for this precious time, and we really look forward to seeing you again, Dr. Saadeh, Dr. Fouad, and Dr. Hirschhorn in a future panel on the medical humanities. So thank you so much, and we will be reading your poetry.
Thank you. Thank
So
you.
Thank you. Thanks a lot. Thank you.
all.
Thank you all.
Have a wonderful day, Dr.
You
Saadeh
too.
Hirschhorn, and have a wonderful evening, Dr. Fouad.
Thank you. Thanks a lot. You
Thank
too.
you so much.
So much.
Thank you.
Bye-bye.
Thank you.
Okay,
Thank you.
bye-bye.
Meet
Bye-bye.
everyone. Thank you.
Bye.
Bye.
It was really good, actually.